Afternoon. I'm Monica Hendrickson, the administrator for the Peoria City County Health Department, and welcome to our daily briefing. On behalf of Peoria, Tazewell, and Woodford counties, I begin today's briefing with going over the to-date totals for the Tri-County. For Peoria, Tazewell, and Woodford County, the to-date totals are 282 cases. Again, that is 282 cases, with Peoria at 192, Tazewell at 71, and Woodford at 19. Again, Peoria at 192, Tazewell at 71, and Woodford at 19. There are no new deaths to report for the Tri-County region. Of our cases, 81.6% are considered recovered, 9.6% are at home and isolating, and 3.9% are currently hospitalized. Again, that is 81.6% are recovered, 9.6% are at home isolating, and 3.9% are hospitalized. In terms of our hospital data, OSF St. Francis Medical Center, Unity Point Health, Methodist, Proctor, and Pekin report a total of 8 ICU beds in use. 4 for persons under investigation, and 4 for confirmed COVID cases. Again, that is a total of 8 ICU beds in use. There are currently 22 non-ICU beds in use for the 4 hospitals. The hospitals are not reporting any deaths in the past 24 hours. Our to-date totals for our Heartland Health Services includes 72 tests completed at their East Bluff site. They did close early based on weather issues. And yesterday's total from the community-based test site out of the Fulton parking lot at the Civic Center was 147 tests. And that, again, was for the May 27th test date. Tomorrow I'll have the values for today's test site there. As the governor spoke of it and our own data shows, we're very much positioned to move tomorrow into phase 3 of our reopening plan. And as we did yesterday, we are bringing in individuals that are subject matter experts to kind of talk about what this means in terms of implementing it in their own facilities. To discuss how the fitness and gym references will work is Andy Thornton, President and CEO of the Greater Peoria Family YMCA.
Thank you, Monica, for the opportunity to be here today to share how the Y is preparing to reopen our facility to serve our members as it relates to their health and wellness needs, as well as our response to needs in the community during the pandemic. Before I get into that, though, I would be remiss if I didn't say thank you for the tireless efforts by so many to keep our community and region informed, healthy, safe during this time. Mayor Artis, Chairman Rand, Monica, Dr. Stoner, our first responders and healthcare professionals, and all their respective teams who have been involved in this effort, thank you. You've done an outstanding job of leading us and keeping our best interest at the forefront of your planning and communication. I commend you for your hard work and thoughtful data-driven approach in the Restore Heart of Illinois plan that works with Restore Illinois to allow businesses in our community the opportunity to reopen safely and more quickly. I know many businesses are following these plans and are grateful for the work surrounding it. After careful consideration and evaluation of our options, the Y has made the decision to follow the guidelines of the governor's Restore Illinois plan. After consulting with our insurance carrier and legal counsel, we had growing concerns with the potential loss of liability coverage should we work outside of that plan, as well as other risks shared by the governor. The Y will reopen on Monday, June 1st, with a robust schedule of outdoor group exercise classes through the morning and early evening and be available for personal training as is allowed in the Restore Illinois plan. In addition, our summer day camp program will begin with limited capacity and will continue throughout the summer. Due to exercise participation restrictions, we are only allowing access to these options to our members. Anyone in the community who is not currently a member of the Y can sign up for membership through our website at PeoriaYMCA.org or by stopping by the Y between the hours of 7 a.m. and 6 p.m. beginning next Monday. We are committed to providing a safe and friendly environment and take the protection of our employees and our members seriously. Proper social distancing and mask wearing protocols will be administered, as well as enhanced sanitation and cleaning procedures practiced throughout the day. We know a good portion of our community is ready to get back to their personal wellness journeys, and we are excited to be more available for that next week. As we look forward to Phase 4 of the Restore Illinois plan, we are planning for more general usage of our indoor facilities and are hopeful for the opening of our outdoor pool. At that time, we will begin to reinstate other programming opportunities such as water exercise classes, lap swimming, swim team, and other youth sports, in addition to individual workouts in our wellness center. Although the Y closed our doors on March 15th, we have been able to serve many community needs. Thanks to the generosity of a large majority of our membership who chose to keep their memberships active, several community donors, and a grant from the Community Foundation of Central Illinois, we have been able to offer services such as emergency child care for essential workers, including medical professionals and first responders. We were able to quickly pivot our focus to the need and have been offering that program since March 16th. In addition, we have provided virtual fitness programming, hosted blood drives in partnership with the American Red Cross, provided staff support to multiple community partners like the Neighborhood House's Meals on Wheels program and the East Bluff Community Center's need to expand their food pantry operation an additional day each week in May. Finally, we were also one of 19 Peoria Public School meal sites supporting their food distribution program. At the Y, we like to say that we're more than a gym, more than a place to work out, more than a place to play ball or swim, and these examples exemplify that. When you belong to the Y, you belong to something greater. The challenge of this pandemic has provided us the opportunity to become a stronger community partner by strengthening current partnerships while expanding new collaborations to serve the needs of our community. We believe that by working together, we can do more to help those in need. Now I'll open it up for any questions.
So when you say summer camps will occur with limited capacity, what are we talking about in terms of numbers there?
Right now we're working off the capacity of 50 individuals, so that means 45 kids, and then we're keeping our groups at a maximum of 10, counting the adult supervision and the children, and then we're keeping those groups independent of one another and working in individual spaces, and they rotate throughout the facility. And one of the great things about the Y is we've got 57 acres of property that they can explore and go outside when the weather permits. So we're following those guidelines as of right now.
Can you get a little more specific about when and where people will be wearing masks? I know when people work out, usually you don't wear masks. So are you requiring people to wear masks while they work out outside? Who wears masks?
Outside. So the question is about what requirements do we have with mask wearing? Our staff at the Y, especially when we're inside the building, are required to wear the mask. When we're outside and when we can practice proper social distancing, which we're saying 10 feet for group exercise, if you look at the DCEO requirements for fitness, they're recommending 10 feet of space between each person, then it's not required at that point. But anytime where social distancing cannot be practiced, there's a mask that's going to be required.
So, I mean, not exactly for personal training, I guess, let's talk about that. There seems to like keep people,
right.
Would they be required to wear masks?
Yeah, they would be while they're in the facility, but as long as they can keep their distance at that 6 to 10 feet range, then we won't require the mask at that point. Okay, thank you.
Before I bring our next speaker, it's come to our attention that some of our stats for the day did not get fully recorded in, and so I just want to reiterate that the to-date total for the Tri-County region is 282 cases. That includes 192 for Peoria, Tazewell at 71, and Woodford at 19. There are no new deaths to report for the Tri-County. There's currently 81.6% of our Tri-County cases are considered recovered, 9.6 are at home isolating, and 3.9 are hospitalized. In regards to our hospital data, we currently have 8 ICU beds in use, 4 for persons under investigation, and 4 for confirmed cases. And there are 22 non-ICU beds in use. The hospitals report no new deaths in the past 24 hours. The East Bluff test site by Heartland Health Services saw 72 individuals tested today by 3 p.m. They did close earlier based on weather. And yesterday, the community-based testing site run outside of the Peoria Civic Center saw 147 tests conducted. So with that, we are really excited about moving into Phase 3 of the Restore Illinois plan. And to assist with that, and as we mentioned prior, our own Restore Heart of Illinois plan has really merged and kind of created an overlap. And we wanted to make sure we were able to provide guidance as well as provide a way for our community to be educated about what those next steps are. To speak towards that is Ross Black, Director of Community Development for the City of Peoria.
Thank you, Monica, and thank you for all your leadership in the last couple of months of this crisis. So I'd like to speak today about the Restore HOI webpage. So that's www.restorehoi.com. This will be an informational webpage and an opportunity for businesses to self-certify that they are going to follow the guidance found in the Restore Illinois plan for Phase 3. It's a simple, straightforward self-certification for a business to go to the web page. They indicate that they will follow the guidance, and then they are able to print a certificate that they can put up at their place of business so that their employees and their customers know that they have agreed to follow the appropriate protocols. The public will also be able to use this website to search for businesses that have gone through the self-certification process. And by doing so, the members of the public that do this search will be able to see which businesses have taken the time to indicate that they will follow the guidance that we have. The third component of the web page is specific to the City of Peoria and to unincorporated Peoria County, and that is to do with the expanded temporary outdoor restaurants and bars. As you probably remember, there's been a lot of discussion about this in the last week. The City Council has taken some action earlier this week on it. So there are additional guidelines that will allow restaurants and bars to expand into outdoor areas, whether that be private areas like a parking lot or onto the sidewalk, or even possibly closing streets in order to put tables out on the street so that they can have customers come in, get their business back open again, but still achieve the distancing requirements and the safety requirements that are necessary. So in order to do that, it's the same process. A business would go to the web page. They would indicate that they want to do some type of outdoor dining. They'll indicate what type of outdoor dining, private property, and sidewalks. They just need to indicate that they'll follow the guidance that is printed on the page, and then they'll get a little certificate that says, effectively, you're good to go. You can open. If a business wants a street closed, then, as you can imagine, that's a little bit of a longer process, so they would indicate they would like a street closed, and at that point, someone from the city or from the county would follow up with them to talk about that in detail. Going forward on this webpage, we anticipate that we will have a frequently asked questions section because, as you could guess, we're getting a lot of questions every day for interpretation, for supplemental information where the state guidance doesn't actually answer the question. So as we're getting these questions and coming up with answers, then we're cataloging all of this information, and that will also be put out on the webpage. We'll also include other helpful information as we come across it, and that could be a calculator to help businesses calculate what their occupancy load is, because a lot of this is based upon, say, a 50% occupancy load or a 25% occupancy load. Some businesses maybe know what that is, some businesses don't, and it's a relatively straightforward formula, so we could put that information out there along with other best practices that businesses in town and in the county and in the heart of Illinois region could follow. So I have three handouts today that will be sent out also by press release. One of them is just a certification form of general businesses, and that is a yellow form that says the business has certified. This is what it looks like, if you can see it from the camera, and this is the form that the business can put up in their window. Corresponding form, which is in blue, is specific to outdoor restaurants and bars, and it indicates on it whether the restaurant and bar will be serving liquor, and if they will have a tent. The third handout that I have is the revised and at this point final guidance for all of the outdoor restaurant and bar regulations. So with that, I would just like to thank everyone at the county and at the health department at the city that worked on putting this webpage together and all this guidance together, as well as all the partners in the region. I'd like to thank the local company, ADCO, that put this website together at no charge to the city or the county. And I'd be happy to answer any questions.
So how long does the certification process take? Because, this is supposed to start tomorrow, so is this something that the businesses have to wait 24 hours?
So the question is, how long will the certification process take? Basically, the business will pull up the web page. They'll see the list of requirements of guidance. They'll hit a button at the bottom that says, I agree, and they will immediately get the certification.
Do you think that there will be somewhat of a backup because there are so many restaurants? It seems to get open. Not every restaurant has a parking lot, meaning maybe a lot more restaurants might be wanting to use the street. Do you think that that'll take way longer of a time than they expect?
So the question is, do I think there'll be a backlog of requests if restaurants want to close streets in order to expand dining? We will work through, just speaking for the city, we will work through those requests as quickly as possible. My guess is that most businesses, most restaurants will have some parking lot space or some other private space to which they could expand into. Maybe it's only 4 or 5 tables to start with. Some areas in town, the sidewalks are wide enough that they could put some tables out onto the sidewalk, which would be preferable instead of closing a street. If they do get to the point where they're interested in moving tables onto the street, then we would start by first looking at the parking lanes and putting in what are called parklets, which are basically small seating areas in the parking lane on the street. And then only as kind of a final option would we look at actually closing an entire street to vehicular traffic.
Are there any consequences for business owners who might take a little bit more than they were offered? So if they are tired of waiting on you, want to get back to them about closing the streets down, and they decide to put their tables in the streets or decide to block the entire sidewalk, are there any consequences for them?
So the question is, are there any consequences if a property owner decides to block a street or block a sidewalk? So for the sidewalk question, all we're really asking for on the sidewalk is that wherever the tables are, there is still a 4-foot pathway, which is a requirement under the Americans with Disabilities Act, so that anyone can get past where the tables are. So that's really the only performance standard that we have in place in terms of sidewalks. So that's pretty straightforward. If someone completely blocked a sidewalk so that someone walking down the sidewalk, just out for a walk, or someone in a wheelchair couldn't get past, then we would follow up on that on a complaint basis, and we'd simply ask the property owner or the business owner to move the tables so that there was access through. I really doubt that a business owner would try to block off a complete street without permission. That's something I've never seen. So if that did happen, obviously that would be an immediate enforcement issue, and I'm sure we'd get a whole lot of complaints from people who were driving down the street and were unable to get through.
So, as has been emphasized previously and was again today, there's really no big differences between the governor's phase 3 and the Sorrel Lake plan beyond some of that minutia, like the hours the Peoria City Council set on Tuesday, the live music, so on and so forth, has kind of been left to local municipalities to figure out.
So the question is there any real difference between the state's Phase 3 plan and what the city is proposing at this point? The short answer is no. There's no real significant light between the two plans. There are areas where the city or the county or other local governments have to provide supplemental information. And the best example right now is for that outdoor restaurants and bars, where the state was really quite silent on any requirements related to that addition. So that's where local government has to step in and say, here is our guidance, here's what we would like to see happen, here's what we are going to require in order to get these additional benefits.
So then I guess my question that follows from that is, why was the decision made to make a new website for this instead of just incorporating this guidance into the city of Peoria or Peoria County's existing website?
So the question is, why a new website instead of just incorporating the information into the city's website or the county's website or the health department's website? I think the short answer is this is information that is shared both with unincorporated Peoria County and with the city of Peoria. And there are other communities that are interested and have indicated they're interested in being part of this larger sort of regional approach so that there's some level of conformity throughout the region so that the public knows that this is what's happening in this community and it's the same that's happening in every other community. And frankly, it's easier to do that with one new web page rather than directing people to 5 or 6 different web pages hoping that they can find the information. The other aspect of the Restore HOI web page is this is all that it's about. You know, the city's web page and the county's web page and the health department's web page is full of information about everything else that those 3 organizations do. The Restore HOI web page is simply about reopening this part of Illinois over the next few months.
Was there a cost associated with creating this website?
The question was there a cost associated with creating this website? The only cost that the company, as I indicated, ADCO, that built the web page, is charging nothing for the creation of the site, just as part of their contribution, if you will, to helping the region get back off the ground. The only cost in terms of city and county and health department was just the staff time that it took to decide what the web page would look like.
So this is, I guess, kind of a combo between you and Monica. I can't tell you how many people have reached out to me just really confused with the state's plan and then the Restore HOI plan. And, you know, as Monica mentioned, I believe when I asked on Monday, we never heard back from the governor's office. But we are currently following the governor's plan. And I know that we have said in the past that, you know, we started creating the HOI plan before he put out Restore Illinois, and I understand that. But I'm trying to understand right now, what plan are we following today? Because in the Restore HOI plan, restaurants could open inside for 50% capacity.
So the question is, which plan are we following today? So for the purpose of the Restore HOI webpage, in terms of any restaurants or retail or any other type of business that is going to that webpage in order to get the certification form, what they are certifying to is that they are going to follow the Restore Illinois Phase 3 guidance. The only local guidance that's on that webpage is to do with outdoor restaurants and bars.
This is supposed to issue to reps. The proposal that was presented at the press conference by Chairman Rand and Premier Artis a few weeks ago, that's moved basically, that no longer applies?
The question is the Restore Heart of Illinois plan as a separate plan moot at this point? I believe that what has happened, just in terms of the passing of the days and weeks, is that effectively the plans are almost identical at this point. And so the decision was made to simply move on with the Restore Illinois plan at this point.
I guess the question that a lot of people have, and whether it's for Monica or for you, what was the point of the HOI plan if we are going to follow the Restore Illinois plan? And also, we have video of you all saying, regardless of if the governor approves it or not, you all were going to move forward with the HOI plan, but you all did not.
So the question is, what was the purpose of the Restore HOI plan if we're now following the Restore Illinois plan? And there were 2 questions there. First question was that when the Restore Heart of Illinois plan was first put together, it was unclear what guidance the state would release. They hadn't released any definitive guidance or details on their Restore Illinois plan. And so locally, we felt that it was important to provide that guidance to our local businesses and to our local residents. So that was the reason that the Heart of Illinois plan was created in the first place. And I'm sorry, what was your second question?
And it may have been more for Monica, because when they introduced the plan the first time, they were at the table, and they said regardless of what the governor does, or if he approves it, we're going to roll this plan out. I've asked you all, I asked Patrick Murik, Mayor Artist, everybody's saying separate things. I don't understand why you all backtrack from that statement. And that's a statement that many people have also heard, not just the media.
I'll let Monica answer that one.
So I think going back, part of the beginning of Restore HOI was the fact that, as Ross mentioned, is that there was no guidance that was coming out from the state. We recognized that we were about to move into another phase and that there was going to be opportunities, and we were getting inundated with questions. So a lot of it was being, as good government, providing guidance and support so that we could open up in a proper way that supported public health initiatives. But likewise, as this moved forward and we were waiting for responses, and then there was different executive orders, different discussions about insurance, liability, professional regulations, as well as even administrative code updates, we never wanted to put any of our entities in a situation where they had to determine about their liability and risk and safe practices. And so with that, really those plans pretty much merged at the end. And you can see that where things such as there was initially in Restore Illinois, there was no restaurant opening at all. Now it's outdoor with certain capacity issues. Likewise, we're seeing the fact that there's going to most likely be guidance for faith-based organizations coming out today, as mentioned from the governor this afternoon. We're also seeing the expansion of how pools are going to be utilized over the summer, whether or not they're going to be moved all the way into phase 4 or are they going to actually be opened up earlier than that. So I think a lot of what the plan was to help even the state start the discussion about how do we reopen. And the fact that Peoria was able to put a very strong plan out there, as spoken to by the Illinois Department of Public Health, and seeing some of our guidance being interpreted and used by the state, demonstrates the fact that locally we were able to help that narrative and understand what our community needed and have those discussions brought forward and then, again, implemented in a safe and public health way. And so I think people want to say Restore HOI was a failure or whatnot, but really it was a way for us to provide guidance and get people to think about what it was going to be like to reopen, as well as to help advocate and support our state entities as they were moving into a very much new phase of this pandemic, which was to start reopening and releasing restrictions. Likewise, I would also add there were metrics in the Heart of Illinois plan that we still are actually monitoring, regardless of the reopening discussions in terms of the larger Restore metrics. And that's because even locally, we might move from, as a region, based on Restore Illinois, but those localized metrics give us a better understanding of our hospital systems and that true capacity. And so, again, I'll say we're still utilizing it, and then what came out of it was the fact that a website needed to be created. And going to the question about why a website, right now there is guidance documentation at the Department of Ag. There's guidance documentation out of Child and Family Services. There's guidance documentation located at Department of Economic Development. There's lots of guidance coming out from the state, but it's now being put into a lot of different state locations. And this one website is actually a place for places to go to and get all of their data. I think a great example is the YMCA. Guidance from the YMCA in terms of daycare is coming out from Child and Family Services, but from fitnesses is coming from Department of DCEO. Those are two different state websites. And so really to have it coordinated in one location helps our community better address a one-stop location, as well as then our population can search businesses and understand who is compliant and who's following these best practices.
So then, is there just, I guess, some miscommunication then throughout the Heart of Illinois? Because then, for example, tonight the McLean County Board is voting on whether or not to, quote-unquote, implement Restore HOI. So I guess Is there not communication between the different municipalities?
I think part of it is when we started asking our boards and our government entities to start responding to Heart of Illinois, we didn't see the newest guidance come out. Again, this guidance came out on Sunday before Memorial Day. So I think a lot of changes happened just in this week alone. And so, likewise, I think the Peoria County Health Committee reviewed the Restore HOI plan as well. And we recognize the fact at this point in time we're very much aligned. And a lot of the discussion now is how do we best ask for compliance. And one of the features is that website so that we can have voluntary compliance and let our public be educated and well-informed making their decisions.
Can you give a clear, straightforward answer just for the general public? Who should they be listening to? Who should they be following, the local leaders or the governor's plan?
They should be looking at the Restore Illinois plan, and locally, if they're needing to understand the guidance that is very specific for their jurisdiction, especially in Peoria County and including the city of Peoria, to follow Restore HOI website for this additional guidance. But again, there's only one plan, and it's Restore Illinois with the supporting information out at Restore HOI.
As my colleague Caitlin pointed out, there are still a lot of communities around here that maybe have not heard about the mindset shift that's happened here in Peoria regarding the HOI plan and still believe that it's kind of its own thing out there. I know not only McLean County tonight, Galesburg also is discussing adopting this, thinking that they're jumping into a major, 11-county effort here. There's some county board leaders that have still said that they were never communicated to you about it and they were surprised by it. I mean, does it behoove Peoria County to come back out and say, like, here's the state of things right now? It seems like there's still a lot of confusion outside of Peoria County about this.
And I can actually refer to Scott Sorrel to answer some of the county-based. I will just say, learning from our local health departments in that 11-county region, we recognize the fact that as public health leaders, we have to provide guidance and, as I've termed it, guide rails for us to operate in a way that is safe for our community as well as healthy for our community. And what Restore HOI initially did was to create that guidance. Since then, Restore Illinois provided guidance just this weekend, and upon comparison, we recognize the fact that a lot of our feedback was actually implemented. And so from a local health department perspective in our counties, we're following Restore Illinois, recognizing that what we had advocated for in HOI has been implemented by the state.
Another question for you before that comes up, live music. I know that they, as you mentioned earlier, City Council talked about that the other night, and they decided that people can have live music, certain businesses, not a license. I know that they said the health leaders, said it wasn't a good idea. It could present a party-like atmosphere, non-social distancing atmosphere. Now, regardless of it, some businesses still can't do it and others can. Do you see that as a problem still? Could those businesses, those restaurants who may have live performances and live music seem like a party atmosphere now?
So the question is about live music and the decision to make it. When the first draft of protocols issued, the guidance that we provided as the local health department was discouraging or saying no to live music on site. Again, for the same purposes of trying to control the population and preventing people from getting too close, the social distancing barriers kind of breaking down. With the state guidance that came out with Sunday that kind of left it up to it, I think what the city actually did was very much aligned. They are not going to issue any new licenses for that. And I think that's appropriate. The individuals that have had live music understand the regulations, understand those kind of requirements and concerns. And so I think, again, it shows how we can take that feedback and be able to be flexible in this, because we're all learning as well every single day.
So, Tim, your question was?
I don't believe it was my question. I think it was
Was it Caitlin, your question?
I mean, I guess kind of a combo from the three of us has there been communication from you with other county leaders about kind of, as Tim mentioned, this shift and more trying to follow Restore Illinois as opposed to Restore HOI? Because, for example, McLean County Board tonight is voting on implementing Restore HOI, but it sounds like from this conversation that Restore HOI is was the plan to get us ready for Restore Illinois, basically.
Right. So just to repeat the question, it's what kind of communication is occurring between the various units of government within the 11 county, or depending on your perspective, 13 county area. I know that Chairman Rand and Mayor Artis are hosting a weekly Zoom call with county board chairs and mayors throughout the area. It may not be every single one, but the overwhelming majority of them are invited and included, and they discuss these various issues. The city manager and I are not part of those calls, so I don't know specifically what happens on those calls, but there are opportunities for those conversations to be occurring and for Chairman Rand and Mayor Artis to be imparting what we're doing here locally. Earlier today, though, I was actually speaking with Chairman McIntyre and his county administrator from McLean County and giving them an update as to what our county health committee did yesterday during their meeting, and which Monica already alluded to what their discussion was. And so as to why it hasn't translated across the rest of the region, I don't have a good answer to that. I know that we're doing what we can to try and get the word out from how Peoria County and the city of Peoria are looking to implement the governor's plan, and how we've been able to see the guidance come down, and it really is. It's been influenced by the work that we've done here within the 11 county region.
So again, Scott, I guess I've already asked the question, but I think I can ask a little bit differently here. So should Peoria County, as kind of the lead coordinator in Peoria City and Peoria County Health Department, the lead coordinators on the Restore HOI plan as it was presented a few weeks ago, come back out and tell these other counties this plan has changed. We are now following the Restore Illinois plan from the governor, and this plan is no longer applicable.
Well, Tim, I think the answer to your question in terms of what responsibility Peoria County and the city of Peoria bear for communicating that the shift, and it's a shift to note that Restore HOI now is overlapping with the governor's plan and the state's plan, and so it's not like it's ineffective or null and void. It's the fact that the two now basically are completely overlap, and what we are doing locally is trying to use that information to implement the state's plan with those local guidance nuances where necessary. Where it becomes our responsibility between the county of Peoria and the city of Peoria, is working with those weekly calls between that Chairman Rand and Mayor Artis host, where they're able to communicate with their elected peers from throughout the 11 or 13 county region, as long as they continue to have those calls and offer that input, that's the opportunity where we have the ability to share that information with those other county board chairs and those other mayors or village presidents.
Hypothetically, and I know you said that this HOI plan is not null and void. It's kind of merged with the Restore Illinois plan. Say we are moving forward now, but at some point we don't move forward, or we're stagnant in the Restore Illinois plan by the governor's orders. Would then our region move forward with the HOI plan, since it was supposed to be a bit accelerated, or would you all stay on the same page with the governor? Since that plan is not null and void, it's null and void,
Right.
as you said.
So, speaking hypothetically, in terms of if the region continued to progress from a healthcare and public health performance standpoint, but the rest of the state did not, or the rest of the North Central region did not, which is the large 27, 28 county region that Peoria and McLean are in, along with the Quad Cities and Winnebago County / Rockford. What happens there is as long as the government, the state government and the governor have various controls in place, whether it be the state liquor license or Office of Professional Regulation for various businesses that have a state license to operate. We've made no bones about the fact that those are levers that the state government has, and we will continue to work within the Restore HOI plan. We'll continue to publish our public health and our hospital and healthcare related data to demonstrate that we're doing what we can to play our part. I think it's a good example. I just saw some data this morning. A month ago, the White House put out guidance to states on how they could reopen their states, and there were 5 key metrics that the White House wanted to meet. And as of this week, and that information is being updated weekly, as of this week, only the states of Connecticut, New York, and Illinois are meeting all 5 of those criteria. And we have an opportunity now, starting tomorrow, where we move into Phase 3. And what happens tomorrow is we kind of reset the clock from a monitoring standpoint. We'll have to see now if we are able to maintain the various healthcare data metrics and performance that we've been experiencing for the last several weeks. And if we're able to do that, that means that we've done our part. That means that the community in the region is well prepared to manage any surge that may come with increased interaction in the community, which means the potential for increased transmission. That also means that we're, at the end of the day, though, we're still going to be following the Restore Illinois plan.